Hi, everybody. Thanks for joining us. I'm Alan Thomas, the Chief Solutions Officer at Leadership Connect. Welcome to our webinar on leveraging innovation to further emerging tech within federal agencies. Emerging tech seems to come in waves, and it can be hard for federal employees to keep up with what's new and how to apply it to their agency's mission. You might have heard of AI and large language models, which are all the rage now. But if you go back just a few years, it was things like blockchain that were on everyone's mind, and then robotic process automation. There was also a hype cycle for virtual reality and the metaverse somewhere in there. Today, we're going to try and clear away some of the fog about emerging tech by talking with three practitioners who are using emerging technology to achieve mission success. Angela Gant Curtis is the director of the VA's Innovation Unit and a recent Fed 100 winner. Mark Potoff is the CIO at the Federal Mine Safety and Health Review Commission. And Colonel Kristen Sailing is the Director of Innovation at the U.S. Army's Human Resources Command, or G1. HUA. Welcome to all three of you, and thanks for making some time to address this important topic. Our audience is fortunate to be able to hear from you this afternoon. So I have a few starter questions, which I'm going to ask each of our panelists, but I would encourage the audience, as we're going along here, to please put your questions in the chat, and we'll try and make this as interactive as possible. So Angela, I want to start with you. During our prep call, I heard you say that data is the new gold. Can you tell us a little bit about how VA is using data and emerging tech to improve patient services?
Sure. Thanks, Alan, for that question. I'll start with the fact that in VA, we have a significant amount of data that we collect or gather from different resources, both from our veterans and other services that we have. Veterans give us data when they come in for face-to-face visits, when they use our online systems, such as va.gov. And so what we've been able to do with emerging technologies like machine learning and artificial intelligence is to use that data in a way that allows us to reduce the need to collect data over and over again, as well as being able to use it in providing better treatment outcomes. So data that we have that we know and treatments that we tried, doing predictive models with that data and determining how we can provide better treatment outcomes using the data we have. We've also been able to use the modern technologies to use that data for our rules-based systems. So data that we have about blood pressure, for example, that's a data point that's needed for determining benefits, eligibility, and compensation. We're able to use the data we have to do that. So those are the ways that we're using our data, coupled with human-centered design, right? None of this happens without interacting with our users to determine how we can best improve the services that we provide, as well as the access to care.
Great. Thanks, Angela. I thought we'd hear human-centered design in today's discussion, and we did in the answer to the first question. So good stuff. Thank you. Mark, I want to come to you next. Let's kind of switch from data. Let's talk security. You're a CIO. You were hired in 2022. Security is top of mind for CIOs, right? So give us a sense for what kind of emerging technology either you're using or you're considering using to address the security posture of the commission. And if you mention the word zero trust in your answer, I've got a very quick follow-up I want to ask you. So go ahead, over to you, Mark.
Great. Thanks for the question. Thanks for having me. It's good to be here. Well, yeah, I mean, with emergent technology, and you're talking about modernizing cybersecurity approaches, you know, a lot of it is culture change, right? And I'll probably go right into zero trust here. And that zero trust is it's all about culture change. It's not even really about technology. It's about adjusting your culture. It's more about, you know, when one goes about modernizing the security aspects of an IT enterprise in a very unique and different way, it's what that cultural disruption goes along with it. So, you know, as an example, we're looking to shift away from, let's say, Active Directory passwords to multi-factor authentication using PIV cards. And, you know, there's that disruption of, do all the agency employees have their PIV cards? Do they know their PINs? You know, it's also a matter of ensuring that, you know, your traffic's encrypted within your boundaries. And then you have to start looking at breaking down your agency perimeters into these sort of isolated environments. So it's migrating away from the culture of this sort of implicit trust that we've all been used to working with, and migrating to explicit trust regarding these perimeters you're breaking down to. But going back to your question in terms of the emerging technology, we've been going into, we've been looking at SaaS security platforms. Zscaler is an option. We've had some ongoing discussions with both industry and other agencies that have been using these platforms. So, we're looking to either partner in with the private sector, or perhaps leverage some of these cloud-based security platforms with other agencies.
Okay, great, thanks. Just a quick follow-up, because you did say zero trust, which I thought you might.
Yeah.
Talk a lot about culture. Who's you're the CIO, right? Who's the right executive sponsor for an initiative like that, right? Where it's a technology initiative, but you really said, hey, it's a culture change issue, right? Who in the organization is the right sponsor for that? Do you think? Is it all the way at the top of the organization?
It could be. The top of our organization are a political appointment, our chair that chairs the commission. That's one. Another one is my immediate supervisor. It's the chief operating officer. Before I got here, there wasn't even a dedicated IT space. There wasn't even a dedicated CIO. So I didn't even backfill a vacancy. I came in here charged with building an IT division from the ground up. So, my first instinct to answer that question really is I think I would navigate straight to my supervisor, our chief operating officer, who's really had the grand vision for bringing me on board and creating this dedicated IT space to help modernize all things within our enterprise, including cybersecurity and zero trust.
Got it. Thanks, Mark. Appreciate that. Kristen, let's go to you next. Broad question. Army's a huge organization, right? And it's really all about people, right? I mean, it's the key component of the Army. Just give us a sense for what's the Army doing in terms of using data and emerging tech to better manage this huge diverse workforce that it has.
I think the first part is providing a little bit of scale and just how huge and diverse we are. Because if you look at from Army Human Resources Command perspective, our entire kind of customer set, you've got everybody who's in all three components currently. So you've got about 1.3 million people, plus our civilians. You've got our former soldiers, service members, our veterans. You've got their families. So we serve, I think we estimated a customer base of about 5.8 million people. And that's just your regular kind of transactional service. We've been building systems for over the past probably 11, 12 years to be able to use our data. We have massive amounts of transactional data, medical data, legal data, just all kinds of data on our personnel, and use that to make better human capital decisions, better assignment decisions, and lately, over the past 3-4 years, better talent management decisions. The biggest thing that data has allowed us to do is stop making assumptions about people's capability and expertise just based on their grade and their branch, but actually look into, what are their competencies? What are their actual experiences? What kind of various things do they bring to the table? And we're moving from looking at them not just as, interchangeable objects, but who is this person? How can we best build that person across the course of their current assignment and their development? How do we retain them? What are their motivations? How do we pair them with optimal teams? So we're doing work across the breadth and depth of the person's life cycle with our organization and beyond. One of the biggest things we've been doing, you brought up the subject of large language models to start with, is bringing on data scientists who are practiced in natural language processing so that we can go through and review the massive amounts of personnel records, because most of that is text string data. Can we use insights derived from duty descriptions long ago to figure out what other kind of things people were doing and other kinds of expertise they were developing? And how can we use this to more quickly review files, identify talent, broaden the talent bench, and then help people make decisions about how they want to grow and develop?
That's great. Thanks. Sounds like a key component of helping someone in the Army be all they can be, which I know that slogan's back. So
it definitely is.
Let's stick with you, Kristen. And this is really a question that I would ask everybody, but we'll start with you, then Mark will go to you, and Angela, come to you finally. Just give us a sense for, we're kind of coming out of the pandemic, right? But obviously a huge change. Give us a sense for how your organization used emerging technology during the pandemic. Did it drive any changes? And are those changes you think that are likely to kind of stick and become sort of part of the normal way the organization does business? Or do you think there's some things that might fall away and you'll kind of return to pre-pandemic ways, if you will?
Oh, that's a very interesting question in our space. And I can't emphasize enough how much the Army has evolved through the pandemic in terms of our use of collaborative technology. I mean, prior to the pandemic, we had a couple of collaboration suites. They weren't really good. We had Defense Connect. We were able to occasionally conference folks in, but if you were calling into a meeting from somewhere else, you were probably calling into one of the conference phone systems sitting on the table. You didn't know who was talking. Nobody really, people a lot of times who were sitting at the table forgot you were there and just, okay, you might be talking, but everybody's shouting over you. So we really didn't have that kind of collaboration. Pandemic occurred, and about middle of March in 2020, all of a sudden we've got, 25,000 people in the Pentagon working in cubicle farms who are all of a sudden a danger to each other. We've got to get distributed really quickly. So I think the biggest thing the DoD did was to bring on its use of Microsoft Teams and to force us very quickly into collaborating digitally. From that time, we've really changed how we do business because we've got in-person meetings, we have hybrid meetings, we have collaborative meetings all over the place, but we're really trying to push toward maintaining a hybrid model. Even if we have a lot of offices returning to the office, we still have a large number of both our civilian employees and our military force who are remote or on distributed teams. And that's kind of been Army business forever. We've had commands that are dispersed across multiple posts. Now we're just looking at multiple posts, multiple locations, multiple houses, however, other ways that people can work. And we have to maintain that because we need a lot of those voices in the room. We don't just need the people in the room. We may want to call over to our other partners who are working on another aspect of the problem. And so if we build every type of engagement with that in mind, and we build collaborative space, then we are including way more ideas. I mean, I think I've said it a few times in open forum, but I really think that remote work and distributed teams are an antidote to groupthink, and it's a necessary part of keeping those diverse opinions in the room. And I don't think we're going to move away from that. We can't afford to.
Yeah, that's it. I hadn't heard somebody frame it like that. But that's an interesting insight. Mark, let's go to you next. Same question, right? How how the pandemic changed things. And I should say, right, for your organization, you're kind of on the other end of the spectrum from the Army, right, in terms of size, right? A much smaller organization, but still distributed.
Correct. Yeah. And when I got here a year ago, we were kind of sort of coming out of the pandemic a little bit, but in terms of what took place when COVID-19 hit at its peak was, fortunately we had a very good, robust telework program that we had in place. And fortunately at the time, all of our mission critical systems were secured in their own FedRAMP space. And it was just really a matter of connecting over VPN and logging into each of those applications. So for the most part, I was pretty impressed for a small agency hearing about this, that we, even without a dedicated IT space, they were able to get something structured in the sense where people could connect from, all the decentralized areas and where they're connecting from. So, I think, and ever since then, we've kind of reverted from that full remote to, as Kristen noted, a hybrid environment. And I think a lot of civilian agencies, regardless of size, are in that space. And it's an interesting time because we're kind of looking at, also physical spaces. Do we need such, large infrastructure when we know when we were at full remote, we were able to carry on the mission pretty seamlessly, and using collaborative tools, as Kristen noted too, that we're using to great success for things like Microsoft Teams, Zoom that we're on now, have really offered and bridged that gap that might have occurred during a full remote environment. So we've been doing really, really well with it. And I think, and again, I'll echo Kristen's sentiment. I think we're here to stay with that as long as there's a secure technology platform in place that will allow agencies to continue doing their work. As long as the mission is being performed effectively, then I think we're going to see this hybrid environment for the long term.
Okay, thanks, Mark. Angela, come to you now. Same question, although maybe could you address it from sort of how did the VA manage to deliver patient services, right? Because it's one thing to say, hey, we're gonna all sort of go and have our staff meeting online, right? It's like, okay, that's great, right? But what about somebody who actually needs medical care, right? Which is the core mission of the VA. Can you give us a sense for what the VA did with respect to emerging tech over the pandemic in that area?
Sure. So just a little bit on our statistics, right? For our patient population, our veterans that we're servicing is about a little over 18 million, right? We have over 1,000 VA care sites, right, that we are managing within our infrastructure, and 1,000 different outpatient clinics in our infrastructure as well. Fortunately, because of the diversity and how dispersed we are as the largest healthcare facility or organization within the country, right? We had already moved to being able to provide our care and services virtually. So when the pandemic hit, we already had our virtual appointment systems available to provide appointments to veterans. We had virtual hearings that we're able to do with veterans for either benefits or appeal types of activities. And so when the pandemic hit, what that did is caused us to dig down deeper, to expand, to make sure we had additional options available. So we had redundancy, right, in the case of one technology failing, so that we can continue to provide our patient care services as well as our virtual team meetings using things as both Mark and Kristen have identified, like Teams. We'd already had Slack as a chat ops and collaboration tool that we were using well before the pandemic, and adding other tools that allowed us to do whiteboarding and those types of activities as well. The other thing that surfaced for us within VA during the pandemic was the need to look at how do we make our existing technologies remote accessible for our veterans and our staff. So one of the applications and meeting with our users and determining what's the best approach, we did, again, that human-centered design thing that I mentioned earlier, and figuring out how do we grant access in a secure manner to patient records, patient files, and being able to exchange information securely and continue to provide those services related to patient care and benefits.
Great, thanks, Angela. We had I'm going to stick with you. We had a question come in from the audience here, which is directed at you. Give us a sense, if you can, of how VA or if VA is doing anything in the area of taking data from wearables, right? Personal wearables that people might have, and kind of linking it to the enterprise data that VA collects. Are there any initiatives ongoing in that area that you can talk about, or anybody giving thought to that?
Yeah, so we are exploring wearables. Internet of Medical Things, right, is our new direction that we're going, as well as virtual and asynchronous care. So in that regard, we want to be able to provide care to our veterans where they are, even if it's in their home, and be able to get that data in so that we can use it as part of the treatment planning and follow-up and continuity of care. So we have several efforts underway and on that front, and making significant progress and being able to have a repeatable pipeline and bringing that data in where veterans are able to enroll devices, in some cases that they own themselves, that contains data such as Fitbit, right? And getting that in front of the clinicians to use in informing their care and treatment.
Got it. Thank you. Kristen, medical not your area of expertise, obviously, but you did mention sort of the Army collects this vast amount of information, including some medical. Are you anything the Army's doing in that area that you're aware of? No's okay. Again, I'm just springing that one on you, but I am curious.
No, no worries. We actually are doing a lot of stuff with wearables. It's over with our holistic health and fitness effort that's going on in Training and Doctrine Command. There's been a lot of research there to look at kind of holistic wellness. And then there's a couple of other efforts that are looking at physical resiliency and recovery time. So we do get into that space. It doesn't cross into my lane in HR right now, but it was something that we looked a lot back when I was working for People Analytics for the Assistant Secretary of the Army and for Manpower and Reserve Affairs.
All right. Okay, great. Thank you. Thanks to both of you. Mark, I want to come to you, switch gears a little bit, kind of step away from wearables, right? And talk about, you're the CIO at a small agency, right? So give us a sense, what's kind of the biggest challenge you think you've had since you've been in the job in terms of adopting emerging technology, right? I haven't heard anybody mention money or funding yet, right? But that may or may not be it for you, but just can you kind of give us a sense for, what's the biggest hurdle, right? When you see some great technology out there and you want to put it into place.
Sure. Well, it's funny because I was having this conversation with a colleague not too long ago. We were talking about that, and we really came away. We both shared these sort of two things. But first, for a small agency, we don't have a lot of moving parts within our enterprise. The challenge that we have found, especially today, with how good and how robust technology is and how stable it is, it's not necessarily the potential implementation headaches that go along with the new technology. It's really two other things. It's one, it's that culture change, that burden of change management, change in the minds of agency leadership and stakeholders as to why we should pivot to a new technology or forego one technology in replacement of another. And it's trying to, interpret very complex pieces of technology in a executive friendly, digestible format so they can understand, they have a better understanding of what the impact is of this emerging technology. And then secondly, as you hit off, it's finding the funding. And especially as a small agency, you have to be creative. Finding resources so that you can invest in this new technology is critical. So there's that I have found, especially over the last year, the challenges that I've encountered as this new CIO, and in finding that funding, we've looked for some external avenues like the Technology Modernization Fund, the TMF. We had some really good conversations with folks from GSA about it. As many might know, the TMF is overseen by a board. It's comprised of IT leaders across the government that have really healthy expertise in technology and operations, and they've established a terrific governance over there. It's really well done. So what we've been examining is how our agency might be able to capitalize on this TMF. And so some of our takeaways from the discussions that we had so far is, one, when you're looking at the TMF, you really have to do your homework. It's not a matter of sending an email and saying, I want X technology, give me some money. It's not at all that easy. There's administrative burden that's going to take place in terms of you crafting a very detailed proposal that should clearly delineate everything that you're looking to invest in with whatever this emerging technology is. Cybersecurity initiatives are hot, and you have a very good chance of going through with those, of course. So another takeaway that we had was, it really needs to be of substantial value of what you're looking to engage the TMF with. And I'm talking around at least about $1 million or above for it to really be worth the board's time to scrutinize your particular project. Now, that's not a problem for the mid-size to larger agencies, but for us little guys, it's a bit more of a challenge to justify. So, and thirdly, being a small agency, you need to factor in that whatever funding is secured, by the TMF, a certain percentage of that goes back to the fund after your project is finished. So that needs to be factored in as you move forward in planning. So it's possible, but it really takes some, some good planning and thoughtful conversations, both
Sure.
internally and externally.
Yeah, no, forethought. Yeah, no, I'm definitely familiar with the TMF. I mean, there's still hundreds of millions of dollars of dry powder that TMF has, but as you
Right.
say, it is not like just hitting the ATM, right, to get some money, right? There's a bit of
No.
a bit of work that has to be done. Angela, let's come back to you. I mentioned in your introduction that you won a Fed 100 this year, so congratulations on that. That's a great
Thank you.
great recognition of your work. I think one of the key things you were recognized for was some work you did as part of a team on the development of what's called e-screening, which is a digital tool that allows veterans to complete clinical forms in advance of their appointments. Can you give us a sense, maybe a little bit of a look to the horizon? What's kind of the next big area that you're looking at, that the innovation team's looking at to improve the veteran experience?
Sure. Good question, and thank you for that recognition, Alan. Let me start by identifying how e-screening started, right? This is an idea that started at one of our VA medical centers in San Diego. So our frontline employees looking for a way to improve the efficiency in the appointment time with the veteran. So what was happening was that the veteran comes in for the appointment. The clinician spends the time during that appointment asking this battery of questions and series of questions, which uses the majority of the time during the appointment. So this solution allowed the veterans, as you indicated, to complete that information in advance of the appointment, so that when they're there in that limited, precious time with the clinician, they're focusing on the things that's important to them, right? And so the innovation approach that we have in VA, we've set up a life cycle framework where we source ideas directly from the field of things that they're seeing as pain points or technologies that they're aware of that could make a difference in allowing them to provide larger service, a larger number of veterans, or be able to provide better treatment outcomes for them. And so in that vein, the things that we're looking at now are, to the question that was asked earlier, what technologies are out there that will allow us to do more of that asynchronous remote patient care, right? Being able to do things like, if you can imagine, kidney dialysis in the home, right? Instead of them having to come into a medical center. So we're exploring those types of technologies, as well as things in immersive therapy, right? Being able to use extended reality and virtual reality to be able to treat things or coexist with the clinical treatment for PTSD or physical therapy. So I love the fact that I get to collaborate with over 400,000 of my colleagues in looking for ways that we can bring in new technologies and being able to bring them in on a small scale to test them out, right? Entering into partnerships with vendors, public sector, to explore the art of the possible and what we can use technology for in both our healthcare and our operations within VA.
Yeah, it's awesome to hear that the idea for e-screening sort of bubbled up from an individual site in VA, right? Really, really cool. Hopefully a motivator for people to to kind of change the way they do things and share that up the line. Kristen, how about along those lines? Is there anything that's going on in G1 where you're trying to source ideas like that from, you mentioned armies, you're serving, 5.8 million people, right? Anything in terms of trying to source ideas from that massive network of people?
So one of the things that we're exploring right now is it's new to us. It's not necessarily news. It's social monitoring and social listening. So what we're trying to do is looking at where most of these ideas are generated, where people are talking about, what kind of services we provide, and trying to meet people where they're communicating. It really just kind of started because both our adjutant general and I are very active on a number of different social media platforms, and that's where a lot of our soldiers are these days. And we had a question earlier about, I think in one of our prep questions, we talked about digital natives. And it's just where people tend to communicate, and we've got to be on those platforms. We've got to be meeting them there, and we have to have a mechanism for capturing the comments that they're making, the ideas they're generating, the problems that they're addressing, and bringing those into our case management systems, or to places where they can be actioned and where they can be turned into actual solutions. So it's not one of the, I mean, there's I don't know how many different DoD innovation idea capturing sites we have, but we're on all those too. We scour all of those, but we're really trying to meet people where they're talking.
Yeah, that's great. You're listening in a good way, right? Listening in a good way. Mark, related to that, obviously a much smaller organization, right? So you certainly can source ideas from everybody in your organization, but you don't have the benefit of hundreds of thousands or millions of people. But what about, there are a lot of small agencies, folks may not know this, right? There are a number of small agencies in the federal government, and some forums where those small agencies come together. For example, there's a small agency CIO council, right? What do you is the council doing anything to kind of share best practices, right, and try and get a little bit of scale in terms of good ideas?
Yeah, when I first got on board here, it was a lifesaver for me. I was upside down just trying to figure out what are some of the best practices for a smaller sized agency, and it was really a critical resource going forward. It's really been a safe haven for collaboration, idea sharing. One product that they recently created was a handbook for small agency CIOs. Leading up to this, which came out, I think, about a month ago, and I think collectively we did a really good job with it. But leading up to that, there was the CIO handbook, but it was really written in a way for more of those mid to larger size agencies. And so it was refreshing, one, to work on that and offer some really valuable input in terms of my findings in the brief amount of time that I've been here. But just to have that as a resource moving forward for the small agencies, because it covers things from cybersecurity to procurements, which the lifeblood of IT service really is procurements, and how to best go about doing that. Interagency services that are offered amongst ourselves, and how to best capitalize with that, especially again with small agencies that have very meager budgets. So that has really been a helpful resource for us, and it's been great. It's a very helpful, as I say, collaborative environment.
Yeah, great. No, thanks for that, Mark. Got a question come in from the audience here. Probably ask this, so I can ask it of all three of you, but I think it's really probably most relevant to Angela and Kristen, just given the size of your organizations. You talked a little bit about human-centered design and kind of iterative development, right? And that requires a lot of interaction with customers if you're going to do it right. So when you're in a big organization like both of you are in, how do you make sure you get the right number of touch points and the right amount of feedback from customers on the initiatives you're working on, right? How do you make sure, right, that if you're going to do something iteratively, right, that you get you get enough data from the user when you're so big? Angela, maybe start with you on that one.
Sure, great question. And it's no small feat, right? You have an agency of employees the size of VA with over 400,000. And so the approach that we use with that is we truly do start with MVPs, and we get that out in front of our users, the actual users, be it VA employees or veterans, and we get their feedback, and we do that repeatedly. It's not one and done. It's the life of that particular solution. We are interacting, and so as our user base grows, it gives us even more users that we can bring in and interact with and collect their feedback as we continue to enhance and improve the solutions. The example of e-screening that we talked about earlier, that's been out and operating for a number of years now, and yet we still meet with our user base, and that continues to grow and on a weekly basis. right, to find out how things are going, to get their feedback on additional enhancements that will improve the experience for the veterans based on their interactions with the veterans that are using it, or with the clinicians that are using it, or others within the medical team that are using the e-screening application. So constantly keeping the customer as the forefront. And from an IT perspective, which is the organization that I'm a part of, and specifically the Chief Technology Office, customer experience is key, as well as making sure we're delivering solutions that meet both the secretary and the CIO's priorities for the agency. So in order to do that, customer focus, human-centered design, and user-centered design throughout the entire life cycle of the solution.
What can you give us a sense, Kristen, going to come to you with that same question, but just quick follow-up, Angela, on that. Can you give us a sense on e-screening, for example, what's the refresh cycle, right? Are changes being made, once a month, once a quarter, once a week? If people are offering feedback on that, can you give us some sense for how often the changes are being made to the application?
So it depends on the nature of the change, right? Some of them are like small tweaks and things that we can do, low-hanging fruit. We can get those done in a week, right? So it can be as quickly as that. Others could take a month. But as I mentioned, we're constantly turning around and making changes. The bigger feature changes, of course, we want to take a little bit more time around the design and getting user feedback to make sure that the MVP of that particular feature, right, is going to deliver something that's usable. So we want the smallest change possible, and the agile approach that we're taking to delivery within VA OINT, and then planning for in our roadmap, how do we build that out even further?
Got it. Thank you. Kristen, over to you now with the original question on kind of, maintaining enough touch with the users to do that iteration, really perform that kind of human-centered, user-centered design.
It's hard in a large organization. I mean, I don't want to downplay that in the least, but we are making a lot of strides just by being as absolutely transparent as possible with what we're looking at, what we think our problem sets are, what we think we need to be doing in order to serve folks, getting the message out as much as we can, and then finding lots of different ways of listening to feedback and soliciting feedback. We've got kind of the typical large organization surveys and pulse surveys and other things that we're putting together, but nobody likes to fill those out unless you deliberately go in action and communicate the results of those actions. So every time we issue one of those, we go through all of the answers, we read them, and we figure out, how do I action a response to this? I got to get somebody some manner of feedback on the issues they brought up and how we're going to get after those. So just to highlight too what Angela brought up in terms of the customer experience and customer-centered design. We look at a lot of different customers from at least Army Human Resources. We look at obviously the soldiers and their families that we serve, but the organizations that we field talent to. We are the major technology and data provider for the entire human capital enterprise for the Army. So we look at those as our clients, and then our employees. So we have to be able to get touch points with all of those different user groups. And a lot of times, I mean, there are issues we can get in personal feedback from in terms of receiving ideas and receiving survey feedback. But a lot of times we just get out and we talk to people. I mean, our staff spends a lot of time traveling and doing focus groups, doing discussions, doing virtual and in-person and hybrid town halls, giving people the opportunities to ask questions. And we've been doing it also with our industry partners. We just last week held our inaugural conversation with industry, where we fielded our HRC 2030 modernization vision to, I think, 200 in-person industry partners and about 500 folks who were dialed in online. So that was an opportunity for us to say, hey, here's what we're thinking. When you guys submit proposals, this is where we're going. Tell us where we're right, tell us where we're wrong, but help us serve soldiers. And that's, as long as we kind of keep that underlying priority there, we've gotten some great feedback on how we can update our processes, how we can incorporate new ideas. And I think the more we do this, the more we just encourage people to talk to us and demonstrate that we're listening, the more quality ideas and feedback we're going to get.
Yeah, that's great. Yeah, I think you're right. I mean, people, when you listen and then they see some of the feedback that they give, get into the product, right? Then that, hopefully that just sort of encourages people to contribute more. Mark, can you give us a sense, when it's related to that question, but a little bit different? Who are your customers? How does, and I'm talking really at the commission level, right? Who are your customers? I know you've got some political appointees who are the commissioners, right? But how do you give us a sense for how you view your customers and how you're connecting with them?
So primarily our customers are federal judges and lawyers. That's essentially what comprises our staff. So and so the underlining discipline are lawyers, and lawyers like really clear communication. And they also provide very clear communication. So that's very helpful. When you go about instituting any sort of change, knowing that it's very important that you communicate early and often with folks. We're currently going through a transition from our legacy phone system to Microsoft Teams Voice, a very hybrid, telework friendly capability where folks aren't going to have their phones on their desks. It's going to be on their Teams. It's a very sort of disruptive but optimal change. And the key for doing things like these is to really engage your customers. And even though they're lawyers, even though they're judges, they like tech. They like to mix it up, and they love to volunteer for proof of concepts and pilots, and that's really, really helpful. And so to make sure that you engage them early and often, because these, especially the politicals and VIPs, they don't like surprises. And it's really important to maintain that steady line of communication with folks here.
Yeah, great. Thanks, Mark. I've done some time in federal service, about 10 years. So I'm going to actually ask a question about lawyers, since you brought up lawyers, but a slightly different spin on it. And I'll go, Angela. I'll go you first, but Kristen, I'll give you the same question. So, we've talked a lot about technology, cool technology, lots of applications, new ways of working, like human-centered design, all good. Still oftentimes though have to kind of work through, different parts of the bureaucracy, which often includes the general counsel's office and the lawyers, right? I had a colleague who one time told me that the general counsel's office is the tunnel of no sometimes when you work with them, right? So can you give us any sense? Is there anything you've done in terms of deploying emerging technology, kind of changing the way business is done at VA? And Kristen, same for you, and from an Army perspective, where you've had to kind of work through the issues and kind of bring the legal community along in terms of what you wanted to do.
So great question. Always fun when we have to go to our general counsel, but they have been amazing partners in the innovation space. This is particularly true with our public-private engagements, where we want to do something with someone in the public, and being able to help us navigate that space, to do it where we're protecting both the veterans, the VA, and allowing our private partners, our public-private partners, to protect their interests as well. So they've been amazing in that regard, in helping us establish processes that are repeatable. In the area of medical devices, the question that was asked earlier, as you might imagine, having medical devices in the home, collecting PII, PHI, where that market, those emerging technologies, and being able to use medical devices in so many different ways has created some opportunities for us to have to really look at the laws and intent of the laws that we have in VA and for healthcare in general, and then being able to define how we use that information to be able to deliver care in the home to the veterans with these medical devices. We've been doing that, having conversations for maybe 2 or 3 years now, and the conversations continue to evolve right, because of changes with cybersecurity laws, right, and the role that FDA plays with those cybersecurity laws, right, and then there's the whole cloud portion of that for those medical devices, and then the FedRAMP authorization. So it's an ongoing dialogue. It's not something that happens just once, and then in the life cycle of doing it, again, I have enjoyed the working relationships and the knowledge that I've gained in understanding the different aspects and what we need to consider as we are exploring emerging technologies, and particularly using them in healthcare.
Mhm. Great. Yeah, it's good to hear that the council is considered a partner in there, and not necessarily an obstacle. Kristen, how about you? You have any stories to contribute to fun times with the council's office?
There are dozens. I mean, over the past 7 years or so of working in the PII/PHI space, there's always different protections. There's IP to consider. We've gone back and forth with the Assistant Secretary of the Army for Acquisition, Logistics, and Technology, ASALT, over what constitutes a piece of software. I mean, at what point do we develop an algorithm or an application and it's now a piece of software and subject to other kind of rules and regulations? But one of the things that we've learned during that time is that all of our key enablers, and we look at them as key enablers, even though, they can be a factory of no if we don't use them properly, we got to bring them in early. I mean, we bring in our general counsel early, we bring in our acquisition folks early, we bring in our budget guys, all the folks who are going to tell you no if you ask them at the last minute when you have a developed plan, can help you better understand your swim lanes and create something that you can actually action pretty quickly if you get them on board as part of the team and bring them in when you're starting to do idea generation. So we don't always do the best job of this, but we've tried to reach out, make those partnerships. Again, kind of want to emphasize the transparency portion of it. It's like, here's what we're actually trying to achieve. So when I come up and ask you for this thing, you're going to look at this piece of technology we're trying to acquire. I want to look at, the intellectual property rights and the data destruction requirements, or the data sharing requirements, everything in there, understanding kind of where we're trying to get to with them being partners in the development. That serves us a whole lot better than just kind of coming to them at the last minute with a plan, because they're going to look at this and say, hey, you guys didn't develop this within any of the guidelines. So yes, we have a legal objection.
Yeah, no, those are good points. Yeah, early involvement, right, seems key, and I think really sort of helping some of those functionals that are supporting what you're trying to do, kind of understand early like what the overall goal is, right, and then how they can play a role in making that happen. Usually people will get, most folks will get kind of excited about that, right? Hey, you're doing something great for the Army, you're doing something great for veterans in terms of delivering medical care. Like most people will want to support that, right? And kind of figure out how to get you to help you get to yes, versus telling you no. But you're right, you got to get them in, early. Okay, let's switch gears a little bit. Mark, I want to come to you and talk a little bit about, as a small agency, right? You small agencies oftentimes think about leveraging services that others provide, right? And it could be in all kinds of different functions. This sort of falls under the header of shared services. What's the commission doing in that area? Can you give us a sense of kind of what you're looking at? Are you using anything currently? Are you thinking about moving to anything? So just kind of give you that big open-ended question.
Yeah, great question. Now, I can't speak highly enough about shared services that exist throughout our federal sector. These partnerships with other agencies have been, just in my experience in my career, been very successful. And I think they've been successful for many reasons. One, they allow the agencies to just focus on their mission and not be distracted by the administrative burden of procurement and the management of vendor contracts. They also offer a reduced total cost of ownership. Though your mileage might vary a little bit in terms of agency size, as some of these entry fees or flat fees. I've been on a campaign to negotiate some of that with some of these interagency partnerships. But they're great because also they can be quick to stand up, and once you have them stood up, you immediately get access to very highly qualified staff that know the product that you're looking to leverage, and the subject matter experts are great, and they'll help you through the implementation process. They don't necessarily just give you the keys to the car and off you go. They're a partner from the beginning to end. And I'll give you an example. Even back at HHS, we were able to leverage to great success the HR IT shared services out of OPM. And that was a great platform for shifting away that in-house burden we had of our HR systems to OPM's platform. And now, based on the success that I had with them, I'm currently in talks with those same contacts that I had at HHS and looking to leverage that here. On the cybersecurity shared service front, we've been looking at the Department of Justice Federal SOC shared service program. This is the only, as far as I know, I think I saw this also in their PowerPoint in their presentation, they're the only federal SOC shared service provider that's out there. And again, as with OPM, by engaging with them where they'll handle the SOC for you, it reduces that burden of having to procure through a vendor contract and the management and the oversight of those contracts. So the other great thing with this engagement that we're looking at with Department of Justice is that they offer their services a la carte, which are very helpful for small agencies, because we may not need a full-blown federal SOC that perhaps a much larger agency would actually need. So it's great because we have the flexibility to creatively scale a solution that's tailored to our requirements and just paying for those capabilities. So it's looking to be a win-win as we continue these discussions and go down this path. So
great. Yeah, thanks, Mark. Thanks for covering that area. Angela and Kristen, something kind of a question, comment sort of came in. Let me see if I can turn into a sort of a question. But when we talk about emerging technology, I don't necessarily want to go off on kind of what's the definition of emerging technology, but how do your groups identify kind of that technology that you might want to bring in? Is there like a scouting function within your organization or somewhere else? Say, Kristen, I can start with you in Army or in G1, where you're kind of looking for things. And Angela, then I'll come to you with the same question. I'll save time. I have one more kind of reflection question at the end. So go ahead, Kristen.
So yeah, absolutely, we go scouting. One of my office's main job is to reach out to the rest of federal government and their partners in academia and industry and see what best practices are, and see what other kind of things are starting to emerge as technology being adopted in certain spaces. We've done this largely by getting out and just kind of making those connections, talking to people, again with the transparency, making sure that they understand our mission set and what we're trying to do. We try to get out to, it's kind of a dirty word in the federal space, but conferences, I make my folks go present at conferences as part of their professional development, but that's also a good opportunity for us to look at seeing what's being researched and demoed. And it lets us bring back ideas of things that we're just going to pilot and prototype, because we do a lot of in-house builds of small solutions to see if they apply to the certain problem sets that we're looking at, and then go from there. We're also looking at putting together what's kind of a strategic issues list for us to be able to post publicly. Here's some questions that we have for partners in academia and industry, or even our research fellows in the Army who are looking for projects as part of their advanced degree programs, their work college programs, or other things they can look on. So we're really just trying to create that funnel for best practices, new emerging practices, so that we can see what people are trying out there and try and leverage it to see if it'll act as a solution for some of our problem sets.
Mm-hmm. Great, thanks, Angela. How about at VA? What's VA doing that you're aware of in terms of kind of scouting and looking for things to bring in?
So we do a lot of what Kristen identified. We're fortunate in VA, at least I consider myself fortunate, in that, particularly on our health side, we have an entire Veterans Health Administration innovation ecosystem. Our Office of Healthcare Innovation and Learning that includes our research and development component, right? Our Artificial Intelligence Institute, as well as representing all of the medical centers across the country with an innovation component there. We have our affiliations with academia, right? A lot of our clinicians are still practicing or teaching with their academic affiliations. And so we have that wealth of knowledge, expertise, and technologies that are brought to the forefront to OIT and the innovations unit for us to help with prioritizing and making sure we're associating those with the priorities for the agency and helping to move those along. Also attend the different conferences and trade shows as well.
Great, thanks, thanks, Angela. Okay, same question for all three of you, a little bit of a reflection question. We're talking about emerging technology today, kind of using that to solve some problems in the federal space. You're all practitioners, but you all have some seniority in your organization. You've been at this a little while from a professional standpoint. Let's say you're talking to somebody who's kind of getting ready to graduate from college, right? And they're interested in technology and how to apply it to solve problems, and they're thinking about where should I go, right? Where should I potentially make a career? What area should I make a career in? Give me some sense for what you would say to that person. Let's say you're having a beer or a glass of wine or whatever your drink of choice is with them, and you're dispensing a little advice to them. And Mark, maybe I'll start to you. What would you say to them to sort of convince them that, look, kind of thinking about those things and doing it in the federal space is a good idea?
Well, I use my son as an example. He's about to go to college, and I'm saying, because right now the cybersecurity space in IT, it's very hot. It's very hard to get qualified people, and I would really recommend they get into that sort of cybersecurity space for one. My experience really is, that what I have seen in terms of successful IT enterprises are enterprises that are on a bedrock of a healthy and secure security, and so making sure that they're really up to speed with these terms. We talked about zero trust, and look into those magical 5 pillars of zero trust, and making sure that you have a robust understanding of that particular discipline. AI is huge with respect to data mining and data analytics. That's a very exciting field right now, and that's it's really what I would recommend, because and I also will echo the sentiments of some of my colleagues. It's really difficult right now in terms of getting qualified, capable, competent folks in the cybersecurity. So it's a really hot job market right now.
Okay, great. Thanks, Mark. Kristen, come to you, and then Angela, give you the last word on this one. But what do you say to that that 21-year-old who's got lots of options, and you say, look, you ought to come work for the Army, come work in the federal government, help solve some of these problems. What's your pitch?
So we actually did this a lot. We actually talked to a lot of folks to get them into the Army technology space. We don't have some of the same glitz and glamour of some of the big technology companies, but we have way cooler problem sets. I mean, we work on some pretty awesome stuff. We have everything from autonomous vehicles to sensor to shooter, computing at the edge, to a lot of the things that we're trying to do just to improve our Army Human Resources technology and make people's lives better. So you get a combination of really cool problem sets, a very large segment of a population that you can help easily with that tech. And we provide that quality of work element, a quality of life element. And as long as those two are on the up and up, as long as we let people work on those very cool problems, we bring them in. I mean, we have a wealth of technologists, especially on the reserve side, who work in a lot of those large companies in their spare time, but they're still drawn back to serve. They're drawn back to the Army problem set and being able to do some pretty cool stuff in support of soldiers.
Yeah, that's great. Angela, how about you? What would you say in terms of trying to convince somebody to come work at VA?
So I would echo some of the same sentiments as my colleagues here, particularly in our mission and what we do, right? No greater mission, that pulls at you and compels you to want to serve, right, and give back to the public sector. In addition to that, being able to work in an organization where you are valued and heard, right, and they're looking for giving you opportunities to explore things that get you excited every day, right, with opportunities with new technologies. One of the things that we have an interest in largely, in addition to cybersecurity and the other positions that Mark identified, is data sciences, right? That whole data thing and being able to use that as our new goal and around the world, and being able to use data. But more importantly, just being in an environment where you are supported, you are given the tools that you need, you're able to come in and learn and grow and advance and have an impact immediately on the veterans that have paid the ultimate price for us.
Mm-hmm. That's great. Thanks, Angela. And I want to say thanks to all three of you for spending some time with us this afternoon. I know I found it a good discussion. I'm sure our audience did as well. So again, thanks to you, and good luck in each of your missions. The American people are counting on you. So good luck, and thank you. Take care, everybody. Bye-bye.
Thank you.
Thanks. Bye.